Ladies and gentlemen, you're welcome to this edition of the 6 p.m. primetime newscast on Equinoxe Television, live from our headquarters in Cameroon's economic capital, Douala. I am Bable Jonathan. In our top stories in this edition of the news, the national president of the Cameroon Renaissance Movement, CRM political party, Professor Maurice Kamto, calls for an independent international investigation into the Ngarbu massacre in the Dogamantum division, northwest region of the Republic of Cameroon. He says that the findings published by the inquiry commission set up by the government of Cameroon is a plan to hide the identities of the top military officials and militants officials of the ruling Cameroon People's Democratic Movement (CPDM) political party who ordered the Ngarbu massacre. And the national president of the Cameroon People's Party (CPP), Kabanwala Edid, member of Stand Up for Cameroon, calls for an urgent ceasefire, immediate ceasefire in the northwest and southwest regions of the country to avoid the worst within the context of the deepening health crisis, the coronavirus pandemic engulfing Cameroon. Thanks, ladies and gentlemen, for joining us on this edition of the news. The national president of the Cameroon Renaissance Movement (CRM) political party, Professor Maurice Kamto, has said that the findings on the Ngarbu massacre in February 2020 in the Dogamantum division, northwest region of Cameroon, the findings published by the inquiry commission is a maneuver to hide the identities of top military officials and top officials of the ruling Cameroon People's Democratic Movement (CPDM) political party and members of government who ordered the Ngarbu massacre. And he is calling for an international independent investigation to reveal the whole truth about that tragic incident that led to the death of tens of women and children. Details with Equinoxe.
Few days after publication of findings on the Ngarbu massacre in the Dogamantum division of the northwest region, Professor Maurice Kamto, national president of the Cameroon Renaissance Movement Party, reiterates his February 26th order for an international and independent investigation to throw light on all circumstances surrounding the gruesome killings and burning of houses in Ngarbu. According to Maurice Kamto, a good number of persons involved have not been included in the Paul Biya's Commission of Inquiry report. Number of persons killed and houses burned has not been mentioned. Maurice Kamto questions why from the onset, military commanders, top state officials, the administration and some politicians played the game of trying to manipulate the national and international opinion on the Ngarbu massacre, whereas they ordered and supervised the military actions. Still, the CRM president seeks to know whereabouts of all those arrested, with claims they filmed and sent images to Human Rights Watch. Elsewhere, Maurice Kamto wants to know more about the financing and equipping of civilians who assisted the military men in Ngarbu. He adds international investigation must be conducted on the so many cases of innocent civilians killed in the Anglophone northwest and southwest regions by defense and security forces. The man who came second during the October 7, 2018 presidential election concludes by seeing the inquiry report as a maneuver to hide identities of real military and political actors who commanded the Ngarbu massacre. On his part, Barrister Agbobala, founder and president of the Center for Human Rights and Democracy in Africa, says the trial of those indicted in the Ngarbu killings should be open to the public, including families of victims. Barrister Agbobala says government should, apart from exhuming the corpses of the victims for proper and befitting burial, with financial compensation to their families, ensure the naming of a street or streets in Garbu after the victims. In addition, the state should declare a national day of mourning on behalf of the killed, after which it can provide free education to the children and the dependents of the victims. The human rights advocate ends by suggesting the state provides pipe-borne water and construct roads in Garbu and its environs as part of reparation.
And the security and socio-political situation of the two Anglophone regions of the Republic of Cameroon has continued deteriorating for the past 4 years. And even with the COVID-19 pandemic hitting the country, guns are still talking, people are still being killed, destruction is still going on, violence still going on in the northwest and southwest regions of the country. And this is why the President of the Cameroon People's Party (CPP) and member of Stand Up for Cameroon Kabangwala Edit is calling for an immediate ceasefire in those regions so that the COVID-19 pandemic can be well tackled by administrative and health officials. And this is a call that has been rising to the sky from all quarters. Even the United Nations Secretary General called for a global ceasefire, but now this is not happening, and there are fears that the worst could erupt in those two Anglophone regions of the country as the COVID-19 continues engulfing the Republic of Cameroon. Take a listen to Kabangwala Edit.
It's a moment when we realize that the other small differences we have, the other challenges we have are small, and we have a much bigger challenge which is threatening the life of everybody. Whether you are a soldier, whether you are an amber fighter, whoever you are today, COVID-19 is threatening your life. We saw a call from the UN Secretary General for ceasefire to allow us to take care of the population. You cannot be having somebody who is sick of COVID-19, the doctor is trying to get to the person, then bullets are flying. So this is a moment to cease. And one of the groups in the northwest and southwest region, one of the armed groups, has actually laid down arms. So the government would have seized that opportunity to actually have a ceasefire. And it also reminds us one very important group, the prisoners. We are really at Stand Up for Cameroon asking government to release the prisoners and decongest the prisons. This is a recommendation from WHO, it is a recommendation from the UN, and Cameroonian prisons are filled with people who are political prisoners. They should be released. People who are waiting trial, they have not yet even been convicted, so they are presumed innocent. They should be released. People who have committed misdemeanors, they should be released. There are even people in prison today who have completed their term, their punishment, but they are there because of a fine of 50,000 or 100,000. They need to release all of those people.
Kabangwala Edit, National President of the CPP and member of Stand Up for Cameroon and one of the mothers of the nation, speaking there. And the members of the civil society and political leaders have been decrying flaws in government's anti-COVID-19 strategies. And the CPP and, of course, the Stand Up for Cameroon Civil Society platform have been undertaking actions on the ground, sensitizing the people and bringing aid to the people in different parts of the country to help them fight the COVID-19 pandemic. And of course, the Stand Up for Cameroon Civil Society platform is calling on all to put hands on deck to kick out the common enemy, the COVID-19 that has continued to engulf the Republic of Cameroon. And one of the members of Stand Up for Cameroon Civil Society platform has put in place or has invented this prototype of a ventilator that can be used in hospitals across the country. It is a locally made respiratory instrument that can be used in the hospitals. It should be noted that there is a very limited number of ventilators in hospitals across the country, and persons have been dying, and even medical experts dying because of the absence of the ventilator. And now the member of Stand Up for Cameroon Civil Society platform has invented that ventilator, and is calling on public authorities to help to facilitate the certification procedure as he invents greater he goes further to improve on the quality and standard of this respiratory instrument that can be used in hospitals across the country. Take a listen to Kabanwala edit in this extract.
Not seeing the Cameroonian government. Yes, the Minister of Health, but the Minister of the Economy beside him, the Minister of Labor, because all of the economy is in crisis. Work is in crisis because companies are closing, putting people on temporary layoff, permanent layoff. We needed all of those people to come together and have a joint strategy. What we are seeing is that the Minister of Decentralization is having his strategy here. The Minister of Labor will come out with one communique here, and so on. We do not see a joint strategy, number one. Number two is that on the level of the medical response, really we have a very big problem. The healthcare is not free. People go to hospital, they have to pay for their bed, they have to pay for their medication. There are no tests. So doctors are asking people to go and do a scanner. A scanner in Cameroon, the cheapest one is 70,000 francs CFA. Sometimes up to 150,000 francs CFA. How many Cameroonians can pay for that? We have people who have shown us, giving us feedback of spending 300, 400,000 as COVID patients. This is not acceptable. The question of tests, we do not understand what is happening with the tests in Cameroon. We received 20,000 tests from the Alibaba Foundation of Jack Ma. Officially, government has written in the report to WHO that they have tested 4,900 people. But there are no tests in the COVID centers. What has happened to 15,000 tests? We do not understand. Now, the government announced with UNDP last weekend that they have received 300,000 tests. But up to now, we have no information about where are the tests going to, which regions are getting tests, which centers are getting tests. Cameroonians don't know whether tests are available or not. And people have been going to the COVID centers and being sent back to the neighborhood.
The Cameroon People's Party and the Stand Up for Cameroon Civil Society platform has set up a committee headed by the Archbishop of the Douala Metropolitan Archdiocese and President of the National Episcopal Conference of Cameroon, His Grace Samuel Aklida, and of course he's assisted by some Muslim or religious and civil society leaders, and the committee will coordinate all the activities of the political party and the civil society platform within the context of the fight against COVID-19 in the Republic of Cameroon. In the Douala 4 municipality, the divisional officer has decided to shut down all churches and mosques in the Bonaberi and other parts of the Douala 4 subdivision within the context of the fight against COVID-19. And he was talking to some Muslim leaders today who were complaining and not understanding why they won't be able to pray in the mosque again, especially during this Ramadan period. And the divisional officer of the Douala 4 subdivision invited them to his office. Isa Dauda was explaining the reasons and of course the importance for them to respect respect the measures that are put in place by administrative authorities to prevent the spread of COVID-19 in the Republic of Cameroon. In the following extract, take a listen to Issa Dauda, and one of the Muslim leaders.
Meeting with the traditional rulers and the imams, the instructions that I gave them this morning is that the mosque should be closed. Muslims can do their prayer inside their compound. So mosques are closed. So I had the meeting with them this morning to inform them that in relation with the fight against the pandemic of COVID-19, Muslims should do their prayer at home. They should not do their prayer in mosques that are supposed to be closed until that a new recommendations come from the hierarchy. Some are not happy, pretending that there are churches that are open. Those churches, they have the same instruction. I will be going out every Sunday to look around and see whether those churches are still opening. But the instructions are there. No mosque or churches should be open. All of them are supposed to be closed.
We were invited by our DO that called us to give us the information that from today all the mosques must be closed. Previously we were praying 50 in the mosque with the space of 1 meter. But today he told us that the hierarchy says that the mosque will be closed, and we are now going home to apply the measure that was given by our sous-prefect.
The senior divisional officer of the Kupe Moninkoba division in the southwest region of the Republic of Cameroon and his collaborators are going the tough way in the fight against COVID-19. They have been moving through different parts of that administrative unit to ensure that the people are respecting all the anti-COVID-19 measures of the Cameroon government and the sanitation rules of the World Health Organization. And it is noticed that many people are not respecting those measures. So the latter, especially the wearing of face mask, many people are not wearing their mask the correct way.
Having a face mask is one thing, and wearing it the right way so as to avoid being infected by the coronavirus is another. This is the case of a handful of inhabitants of the 3 subdivisions that make up Kupe Maningoba division, southwest region of Cameroon. Some of them could be seen wrongly wearing their face mask.
I'm not protecting it's because of, due to the conditional climate, there's a lot of heat, that is why. I'm not protecting myself, but when the time I'll put it up.
Really, I've understood that I have not protected myself, but I have to adjust it immediately.
Okay.
Local authorities of the area have expressed dissatisfaction to the poor preventive habit showcased by some of the inhabitants.
This mask is very, very important to prevent people from catching this COVID-19. Prevent people from catching this COVID-19. So we are pleading, we are asking our nose on the mouth, because some people are wearing the mask but are putting it down on the chin, exposing in this way the mouth and the nose to the virus.
They went further to advise the population to implement government anti-COVID-19 measures so as to prevent them from being infected.
Since there's no official treatment per se for coronavirus, the only way to prevent, as we say, prevention is better than cure, is by washing your hands all the time
avoid touching your eyes, nose, and mouth. Cough with a flexed elbow or use tissue that will be disposed after. Keep the 1 meter distance that has been prescribed by the government, and make sure that you stay at home as much as you can and avoid greeting people.
Local authorities insist that the coronavirus pandemic is real, and barring the way of the virus by respecting hygiene measures should be done by all.
In the Southwest Regional Capital, Governor Bernard Bilai has received a consignment of anti-COVID-19 aid from the First Lady, Chantal Biya. Some equipments sent by the First Lady to the Governor for the fight against the COVID-19 pandemic within the Southwest region of the country. Derek Jato reports.
Samuel Malombe, president of the Transporters Syndicate here in Buea, on the field with his collaborators. This soap is given by Madam Chantal Biya, he told his members, the taxi drivers, as he distribute the consignment to them.
This soap is here, so now for Mami Chantal Biya, he come on for Serac, for Mami Chantal Biya, so they more distribute for more fight the coronavirus where they outside, where they all over the whole world, so they are under attack them. You keep wash your hands.
Use it to wash your hands regularly, he says. Earlier, the Southwest governor, who represented the First Lady, handed these sanitary kit to market women, Transporters Syndicate, and an orphanage at the esplanade of the Southwest governor's office in Buea. To Governor Bernard Bilai, these materials to fight coronavirus came just at the expected time.
My message is that, following the good example of our mother, the First Lady, the other leaders, the other stakeholders of the region should come to do the same, because we have many internal displaced who lack the basic needs to sustain the implementation of those measures.
With 13 confirmed cases of coronavirus in the Southwest region, everyone must sit up and take responsibility.
Nobody wants to die. And trying to do all the protective measures.
I feel very happy for this thing with Chantal Biya done for me. It be very important because we never even get money for go to buy these things there for fight this sick.
So I want to take this time to thank Mami.
To help to fight against the coronavirus, we'll make sure that all man will wash it out.
Some sources even say the Northwest and Southwest regions should have special measures as the nation struggle to keep the fearless coronavirus at bay. If the Cameroon government really want to see these regions already weakened by war to survive the pandemic.
And the United Nations International Children's Fund, UNICEF, is helping council authorities in the town of Douala to enhance their fight against the COVID-19. Today, some officials of UNICEF were in the Douala 4 subdivision, and they handed over some anti-COVID-19 material to the administrative and rather council authorities, notably the Douala City Mayor Roger Mbassa Ndine, who received those equipments and products from the UNICEF officials that will be used, or the equipments will be used in the fight against COVID-19 in the town of Douala. Now take a listen to the UNICEF resident representative Jacques Boer in this extract selected by Donald Briskamga.
Will be used in public places in Douala city, especially markets, bus stations, and other places where population may come, like hospitals. At the entrance of the hospital, these devices will be positioned. We also are symbolically giving to the municipality a first batch of 2,000 locally produced masks. These masks are in line with the norms that have been edicted by the government, and altogether this mask will be 100,000 that will be given progressively to the city to the population, the most vulnerable population.
She came in with other passengers of the Air France Airbus that landed in Cameroon on March 17, 2020, and many of the passengers tested positive for COVID-19 and have been put under a treatment, but she has tested negative, and she is an 80-year-old woman who was declared COVID-19 positive by the social media, but today she has tested negative and she's now in her home on self-confinement here in Accra, Douala, Innocent.
Mama Marie, about 80 years old, today glorifies God for protecting her from contracting the coronavirus. She was on board one of the problematic flights which landed at the Yaoundé-Simalène International Airport on March 17 from France. All passengers on board her flight in particular were immediately quarantined for 14 days in requisitioned hotels in Yaoundé before COVID-19 tests were conducted on them.
Pour la prise en charge, l'accordéon manque un peu de formation.
After the 14 days, majority of the passengers tested positive for the coronavirus before they were isolated. Despite the journey with the suspected cases and group quarantine, Mama Marie, at her vulnerable age, featured amongst those screened negative for the virus.
Moi, je lui rends la grâce de m'avoir sauvé. Même si je m'en vais demain, il m'a déjà assisté. Merci beaucoup.
Despite this, she regained her Accra residence in Douala, but decided to be in absolute confinement, not to see the ugly face of the dreaded coronavirus.
Nous avons tous besoin de la solidarité.
She makes sure everyone around and visitors make use of the sanitation materials by washing their hands and sanitizing them regularly.
C'est une exigence.
While implementing the hygiene rules and government's anti-COVID-19 barrier measures, Mama Marie advises Cameroonians to be responsible in comportment as instructed by the government.
Qu'il faut se respecter entre nous, c'est-à-dire aime ton prochain comme toi-même.
Love one another as yourself, she stresses, so as not to spread the virus.
Si je sais que j'ai le microbe et vous venez en face de moi, je vous embrasse, c'est parce que je suis égoïste.
To her, God can only rescue Cameroonians from this pandemic if they mutually care and love one another, value their health and the life He gave them.
And the recent figures on the COVID-19 pandemic in the Republic of Cameroon from the Ministry of Public Health indicate that as of today, 1,430 positive COVID-19 cases have been recorded in Cameroon, 719 active cases, 20 cases that are under oxygen, and of course 120 who have been hospitalized. 668 have been successfully treated, and 43 persons have died of COVID-19 in Cameroon. Coming up in Talking Point, meet our Southwest correspondents Derek Jatto and Dr. Nkengafak Nyawung Fobela, District Medical Officer, Bangem, Southwest Region of Cameroon.
Good evening, Babila Jonathan, and welcome to Boya. My guest is Dr. Nkengafak Fobela. He is the District Medical Officer of Bangem Subdivision. Bangem is the divisional headquarters of Kupe Maningoba Division here in the Southwest region of Cameroon. He is a specialist in public health. Doctor, welcome to the program.
Thank you, Mr. Njato. My pleasure being on air as usual.
This is Talking Point. Now, we talk about, we are discussing paramountly about coronavirus.
Yeah.
Cameroon is at 1,300 plus as at now. And the Southwest region has confirmed 13 positive cases. You're a medical doctor and a specialist in public health.
Yeah.
How can you assess the evolution of things and what lies ahead for a region like Southwest?
I can say it's growing up at an arithmetic progression. Let's not say geometric, because a geometric would be rapidly fast. Remember, Southwest just came into Corona early last month, so we are now at 13 cases. We can't just say we can be sure per se, but we think it's an arithmetic progression, and we just keep on sensitizing as much as we can so that people go through preventive measures and we see that it doesn't get to a geometric progression.
Is there any cause for alarm at now in the Southwest region?
Yes, the fact that we have a case and the fact that it's an airborne disease, not only that it's an airborne disease, it's a zoonosis, meaning that it can be transmitted through animals, birds, and all that, bats. So we have to be very careful. We have to be very careful and very cautious and maintain all preventive measures put in place by the government.
Now, let's talk about the Southwest region, the coronavirus, and the Anglophone crisis. Many people have it. I'm talking about civil society activists and even some politicians. They say a special anti-COVID-19 measure should be put in the Southwest region or implemented in the Southwest region if the government really want these two regions, I'm talking about the Northwest and Southwest, to survive. Because this is a region that for 4 years they have been hit by war. I'm talking about the two regions, and it is already difficult for them to even keep or follow these government measures to fight against coronavirus. What do you think as a medical doctor on the ground?
Okay, I think it's a very pertinent point. You notice 3 days ago there was a meeting at the governor's office where there was a task force to actually target the problem, because targeting the problem in the Northwest and Southwest is different from the other regions. Remember, we see our people in the bushes, we see our people who don't have access to water, we see our people bathing together, we see our people feeding together. So it's a really critical point. But I think the best way to target it as a public health specialist is we should be gearing towards confinement. It's going to be difficult because we think of the economic consequences, the political, the social, but we should be getting towards confinement, meaning that those that are keeping the virus are being treated. We quarantine those that are the contact tracers, and then we make sure that gradually the virus is being eradicated, because if it gets to the bushes, it's going to be terrible.
Do we have the facilities for the confinement? If we know the Southwest Regional Delegate of Public Health, Dr. Zacchaeus Nanje, did mention that even these 13 cases confirmed in the Southwest region is just a tip, because they don't even have enough testing kit.
Yes.
Which means that there are people moving with the virus in the Southwest region. We don't pray for that, but statistically, it is possible.
Yeah, very possible.
Now, what should be done? Because the preparedness seems not there. Even the testing center that was created, some in the University of Boya, is not functional because of lack of testing kit and lack of some materials. We were made to understand that the manpower is already there, but the logistics, the technical equipment to accompany that is absent. Are we playing with time here?
I think there's a time issue, but you know, Corona is hitting all over the world. I can tell you, in the United States, there are shortages of masks sometimes. You know, the companies, even the ventilators, it's not easy. Corona, I must say, took the world, let's not really say by surprise, but it came in a very critical time. And yeah, they spoke about the emergency building of the building for confinement at the regional hospital in Boya and other things. Yeah, there's a time factor. But what I advise for every local person is just do your preventive measures. We pray, you know, already in the country, you know, the prioritization for health has always not been the best. You know, we know this. For example, if you count the country's budget put on health generally, is not at its optimum, but we just pray with the basic resources that we have, we try to manage and see how we can help our population.
Okay, doctor, let's talk about Bangem. where you're working specifically. I know about Bangem, and I know when we talk about Bangem, especially in the wet season, the next statement will be Bat Road. Now, if a suspected case of coronavirus is detected in your health post, do you have even what it takes to keep that person or to transport that person? Take into consideration that, you know, it's a very delicate type of a pandemic. We have reports of even health personnel that have been tested positive because in the course of treating a case were contaminated. So do you have even the personal protective equipment or the transportation, like an ambulance, in case a suspected case is reported in your subdivision?
Okay. You know, Corona is a multidisciplinary team. Equinoxe was in Bangem 2 weeks ago, where we did massive sensitization with the mayors, with the parliamentarians, with the SDO and DO. The first of things is roads were not good, but they have been put in state where at least you can have very quick access to the nearest region, that's Konsamba. You must know that for now, Corona cases have not been encouraged to be managed at the level of the district, but the list of things is to transport. Unfortunately, the district hospital has no ambulance, but we have a car that we have put in place. The council helped us with one, and then we've already made a place for confinement, so that if there's a suspected case, we confine and quarantine the contact tracers before they go for testing. So at the level of the districts, we have not been given the power. So now the management is at the level of the regional hospitals.
Let's talk about the psychological impact of this pandemic on the population. You are a specialist in public health. How has it been with patients in the hospitals? How has it been with even people in the community? Some even have it that hospitals are more or less empty because people are scared of even coming to the hospital, that they might be quarantined. How is the situation, the psychological impact of coronavirus in the Southwest region?
Yeah, it's a big blow because like we're talking the Anglophone crisis, and then now we have Corona. It's a big blow. People are really psychologically defeated. You must also know that every patient that comes to the hospital, like 60% of them have that psychological impact. Not to talk of when there's a pandemic and everybody's on its grounds. Now, the basics of things is that we've made the case definitions. It's all over Bangem, in churches, all the hospitals, public places, all offices. If you have fever, cough, difficulty in breathing, please don't hesitate. Our numbers are all over, and there's the general national number 1510. Please, so that it's not only for yourself, you're preventing the other people around you, so that we pray that it doesn't get to a deadly pandemic in Cameroon.
Now, Boya here has the highest number of coronavirus cases, 7 out of the 13. The mayor of Boya municipality, in the person of David Mafanina has been going around. He just announced Operation 10,000 masks to share to his municipality a move to fight this killer virus. Now, at the level of Bangem, we followed what the mayor of Bangem is doing, and people are coming on board. Even yesterday, Chantal Dia came with sent some consignment here. The Samuel Etofis Foundation equally came here. Even the Center for Human Rights and Democracy for Africa, headed by Barrister Abba Bala, everybody is coming on board to fight this common enemy. Now, but if something needs to be done concretely, what is it that needs to be done? Because you people are the one facing, you people are the one at the front.
Yeah.
It's a war.
Yeah.
Take it or leave it, and you people are the one fighting the war at the front.
Yeah.
What should be done? Because some people, maybe they might be diverting resources to where it might not be that necessary at the moment. Okay. So where should resources be diverted to now?
They should be diverted more at the level of the hospitals. Yes, first, the preventive measures, assessing the community, the mass, is really good, because if you don't assess the community, you will not prevent the virus per se from getting to the hospital, but the capacitation to be done. We have many health centers with no oxygen machine. We have many district hospitals with no oxygen saturation, not to talk of ventilators. We have many of them that are not yet incapacitated. They don't have those surgical masks or the complete dressing for corona, and if they meet up with the case, especially in the north and south in some places. So I think yes, the foundations are doing good, but they should go to at the level of the hospitals. They shouldn't end just at the level of the community, because if it's not handled well at the hospital, then it will be a blow too. And then certainly we have some of those facilities that don't have ambulances to transport those patients. So
they should be thinking in that direction
towards that. And the government in general, with time, if the numbers go high, we should think of total confinement.
When you talk of total confinement, what are you implying?
Quarantining everybody.
A lockdown.
A lockdown.
You are suggesting a lockdown?
Yes, with time. Let's see how it goes, because we don't want it to get to the 500,000 like in the other countries, because it will be a blow in our country. We don't have those resources.
Others are calling for total lockdown, but with the specificities of the northwest and southwest regions, others say first, to pipe down or to calm down the temperature, there should be a bilateral ceasefire. The separatists should cease fire, and the government should cease fire for the moment, for the population on both sides to stay alive. You are in Bangam. We know how hot that zone is. Everywhere in the north and south region is hot, no doubt. Yeah. Do you think that ceasefire can play a magic here, and do you think it can be respected by the both parties?
Everybody values health, and knowing that corona is very deadly. We just had the young guy, the 34-year-old died in the US in Maryland. It's a Bangam elite. So sad, he died of the coronavirus. From sober, he went to Sase. So when it's a pandemic and it's health threatening and it's threatening the psychologies of everybody, please, the ceasefire is at this point is I think is helpful. It's not that the problem is solved, but let's ceasefire, and we should be going towards a better dialogue, because like the other one per se, it didn't work out well. It was more of a monologue, and we see how this Anglophone crisis can put to an end. So for now, I think the health part of it, for the health and the good of everybody, I think the ceasefire is recommended, so that we target the health thing first, emergencies first.
Now, tell us about activities at the level of your health post in Bangam subdivision. Bangam is the divisional headquarters of Kupe Maninguba division in the southwest region of Cameroon. Let's talk about the staff strength. What are some of the challenges that your health post, your hospital is facing? We know coronavirus has blanketed everything, but we still have other diseases that are killing people. We still have malaria. We still have other protracted illnesses that need medical attention. What are some of the basic needs that your hospital is yearning for?
Okay, thank you for that opportunity. At the level of Bangam, the elites, the parliamentarians, the ministers, the administrative, are doing their best, because they're always donating us equipment and things like that, but we always ask for more. First of which is the ambulance. We have personnel. Some of them were they were volunteers, and we try to see how we can make up with them, and we are proposing all the time to the government that we see that these people are integrated into the system. I think I have one health center that currently lacks a personnel. We're working on that. We've sent a voluntary there.
Which health center is that?
Gypsy. Yeah, I know you've been to Bangam. And I think those are the major challenges for now, but at least we're trying to see how we can make it better.
You are a specialist in public health. You are the district medical officer of Bangam subdivision in Kupe Maninguba division of the southwest region of Cameroon. Can you just look to this camera and tell the people of the southwest region, Cameroon and the world at large, what somebody needs to do to stay ahead and beat this fearless coronavirus?
Okay, we won't be tired of talking about the preventive measures. Keep the 1 meter distancing, wash your hands regularly with running water and soap or hand sanitizer as many times as possible. Avoid salutations, avoid overcrowding. If you are to sneeze or cough, use an outflexed elbow or tissue and you dispose of later. Avoid the public gatherings. Even if it has to come to that, in markets, in the churches, try as much as possible to keep the 1 meter distance so that we stay safe from this coronavirus. Thank you, Mr. Njato.
Thanks very so much. Doctor, you are Dr. Kenyafak Fobila. You are the District Medical Officer of Pangem Subdivision. This is Subdivisional Headquarters of the Maningova Division in the Southwest region of Cameroon. Thanks for stopping by and thanks for talking to us on Talking Point.
My pleasure.
And this is all that we put together from the Freedom Man Cameroon. Goodbye from Boya.
Thanks a bunch, Derek Jato and Dr. Kingafak Nyawung Fobela, District Officer of Pangem in the Southwest region of Cameroon. Thanks, ladies and gentlemen, for staying with us. That's it for today. Have a nice weekend.